Welcome to this short video about the Public Involvement in Research group that has been formed at the Advanced Wellbeing Research Centre. At the AWRC, we are committed to involving the public in research and ensuring that our research benefits individuals and wider society, for example, influencing policy and the way that health and social care is practiced. This is why we set up the Public Involvement in Research group. And we were very pleased to be helped with this by Health Watch Sheffield, who enabled us to invite people from across the city with a whole variety of interests and experiences to be part of our AWRC community. The members are helping us with research feedback. We ask about idea development, preparing bids for submission that achieve funding, and during project delivery, or writing up the findings from research. All of those different ways are important in relation to getting public involvement and public views into the research. We have people from varied life experiences living with health conditions that gives an alternative perspective to the researcher. We're absolutely committed that our researchers use the Public Involvement in Research group to gain insight into how their research projects will impact and link, and we link across the academic community with people in the local area and beyond. We are very pleased today to have a number of people who can tell us a little bit more about why the PIRG is important to them. But first of all, over to the coordinator, who is Claire.
Thanks, Sally. Hi everyone, so I'm Claire, and as Sally mentioned, I'm the coordinator for the Public Involvement in Research group that's based at the AWRC. So the first meeting was held back in September last year, virtually of course at the moment, but the group has grown to around 21 members, and we've got quite a diverse representation from across the local community. So the main activities for the group, we have quarterly meetings where the members that can attend. We'd like to hopefully be able to do this in person as we move through this year, but at the moment that's all done virtually on Zoom calls. So some members attend the meetings and others just sort of participate in the research side, which is absolutely fine. All contributions are really welcomed and participation. So the members of the group, as Sally briefly mentioned, they will appraise and feedback on research proposals that have been submitted, and on occasions they can also go on to become co-investigators on grant applications. This year, sort of the plan for PIRG is, for the Public Involvement Research Group, is to consolidate our terms of reference and establish co-chairs to work with us to sort of drive forward the agenda and drive forward what we want to get out of the group. We're going to be testing the use of our policies and procedures and recognising that public participation in research. We're using the good practice guidelines from Involve, which is the National Institute for Health Research Policy for Public Involvement. We're wanting to try and make the Public Involvement in Research group feel like a community, so we want everybody to sort of feel part of that community, and we're going to work really hard to ensure that we feedback from not only the projects that they're reviewing and taking part in, but also on what the wider activity is within the AWRC, so the members can really get a feeling of how they fit in and what they're part of. 6 research projects have been reviewed so far, and we're looking to increase that activity over this coming year. The feedback that we have had from the researchers so far has been really positive, and the contributions have been really informative, and they've provided that non-research perspective. So I'm going to hand over now to the PIRG members that we've got that have kindly joined us today, to just tell us a bit about what they think about the PIRG and why it's important, and what contributions, what contributions from their perspective. So I'll hand over to Brenda.
Hello. The Public Involvement in Research group is important because, as members of the public and representatives of service users, we can review the public-facing documents such as participant information sheet and consent form. We can identify terminology and text which may not be clear to potential research participants, as well as proofreading the documents. We can also identify any requirements of the participants which may deter participation, and we may even be able to contribute suggestions about these. We may also be able to suggest further measures for them to recruit participants. Unlike some patient and public involvement groups, the Public Involvement in Research group facilitates public involvement to review research studies at depth and at an early stage, including reviewing the full research application prior to submission. This approach is a move towards co-application and co-production. Thank you.
Thank you, Brenda. Over to Danny.
And Danny, from a public perspective, I think it's quite obvious that a group like this has to keep an eye on the public's benefit from the research being done, from how, if it's public money, how that public research money is being spent, and how do we help that? Well, we watch out for those aspects, but we all bring different skills to this group. And just as an example, out of the 5 members here this afternoon, there are only 2 I've met outside a Zoom meeting, but I know Brenda, I've encountered Brenda a few times, and I know she's really gives a kind of in-depth perspective on the ethical aspects of research and the procedural aspects of grant funding. So that's a typical, that doesn't sound like a layperson, but there you go. That's the Brenda I've encountered. Quite differently, Wakath brings a community aspect to our group. I think I've learned a lot in the brief time that I've known Wakath about how community support works in the area that AWRC is located, the centre is located. So quite different aspects, and I'm sure as I get to know other people in the group, I'll learn, as I already am, many different skills that they bring to it. So how did I get here? Well, I've long had an interest in science. My background is engineering and scientific research in engineering, but I've long been interested in medical, social, and care research. I'm involved with a couple of national funding bodies, but I think personally also this gives to me what I called a bit of a mental gym. In other words, it's part of my training for my Healthy and Active 100. The physical side is something else. And let's say, I like to think that we're really here to, obviously we have to be critical friends, but we're here to support researchers. We're here to support the administrative team and get things moving the best way they can here. So one final thing is, socially, I think it's a good thing to be on this group because we get to meet some interesting different people from our region, both within the Advanced Wellbeing Research Centre staff and even more our colleagues on this group. So I'm very happy to be with it for now.
Thanks very much, Danny. Shirley?
Hi, I'm Shirley, and I got into this group from Healthwatch Sheffield. I've been a member of a couple of research documents. I've also done one out of Sheffield, which was for Nottingham, and it was research into fibromyalgia, and I was the PPI. And I didn't really know what I was getting into at that point, but it certainly opened my eyes. So, you know, I really know now what PPI means. The public involvement into research group is an excellent project, and it's there for the public. So I really think that we need to get out there and and push this towards public involvement, whether it be, you know, in a small way or reaching out to communities, because I think that's the way forward. I'm quite passionate about exercise and well-being for people of all ages, and I believe that there is something out there for people to do. You've just got to sit down and find it. So I'm hoping that working with the public involvement and research group, that we do actually find something for people to be able to attend. And I think family involvement is very critical, because in these current times, people can't get out, they haven't got the resource to Zoom. So how do we do it? Well, perhaps getting in touch with the carers and the family so they can all do it together. So I'm hoping that some of the research that I've been involved with helps get people involved in whatever they want to do, dancing, exercise, or just, again, become on the public information and research group, because we obviously need to have more people and more ideas.
That's great. Thanks very much, Shirley. Over to you, Wakas.
Hello, I'm Wakas Hamid, and I am a local resident and also a local worker working for Donald Wellbeing, which is a local community organization. I found out about public involvement in research group through my work, but it interested me as a local resident to be part of a wider team, and a team especially which I have met once, and really think they have varied skills and experiences which we can share. Why I joined, another part of that is that I believe I can, through my experience, language skills, and I can bring the friends, family, and local community perspective to this group and share ideas, and actually take some ideas back and do use during my work with community and encouragement when I do community groups or face-to-face with people. So I think I could use maybe these skills. Another part of that is that during my work with long-term conditions and especially collaborative work, I have some experience which I think, which we, in the first part of first meeting, it came clear to me that I can use my experience, and it will be beneficial for both community, myself, and the group. Thank you.
Thank you, Wakas. And over to you, Beatrice.
Hi, everybody. My name's Beatrice. I first approached this group because I was interested in the link between chronic fatigue syndrome and long COVID. But it's been much more than that since then. And there's been so many more interesting things that we can be looking at. And what I find fascinating is so many people coming together from different backgrounds and areas of expertise, that we can build up a better picture of all these illnesses and how they can affect people, especially in the long term, and how we can support them. One of the main aims is obviously to help people and to make them move, and to improve their well-being. And I think this is vitally important. But what we want in the group is this continual exchange of ideas, and with that, the knowledge to help provide a positive impact on the research, and so that the patient and the public voice is included and heard within all aspects of the research. I think it's vitally important. Thank you.
Thank you, everybody. That's really great to sort of hear your opinions and your thoughts on the public involvement and research group so far. So thank you for everyone for attending the call today. If you are interested in finding out a bit more about the public involvement and research group at the AWRC, then there will be a link to the AWRC website with this video. Thank you very much.
Thank you.